Hello everyone. So this is the annual station from maternal medicine module, and already I have discussed in the this previous session one von Willebrand's disease, and this is going to be the other case that is a Graves' disease. It's being asked in the exam. So this is the simulated patient task. Always you have to see they can come as a simulated task and also as a structured discussion. It is a simulated patient task, and they will assess your skills, information gathering, communication with the patient safety, applied clinical knowledge. So you are supposed to see everything thoroughly on the screen, and you are an ST5 register covering the antenatal clinic. Your next patient is Mrs. Victoria George, 33-year-old at 9 weeks of pregnancy. She is a known case of Graves' disease on propylthiouracil and propranolol. She wants to discuss a pregnancy care plan. So investigations are attached here, thyroid TSH, and you can see them on the screen. Everything is showing that it's not uncontrolled, it's uncontrolled. That is, that is going into hyperthyroidism. So from all these things, you can see it is hyperthyroidism, it's not controlled. And she's also, blood group is given, BMI is given. So no need to ask again the patient. Once you know these things, whatever is given in this in the station, no need to ask the patient. So you have to, what is your task? You have to take appropriate history, that is targeted history, answer concerns, and outline the management plan. These are the things every maternal station, what they will have. Now, I'm going to start this case now like this. Hello, introduction. Hello, I'm Dr. Manjula, one of the doctors in the antenatal clinic. May I confirm your name and age, please? I am Mrs. Victoria George, doctor. I'm 33-year-old. How may I address you? You can call me Victoria, doctor. I can see that you're pregnant at 9 weeks. Now, agenda. I can see that you're pregnant at 9 weeks and you're taking medication for your thyroid problem. And so you're here to discuss your pregnancy care, isn't it? I can also see your blood reports which are attached here. Before I discuss, Victoria, before I discuss your pregnancy care plan and also your thyroid problem, I would like to ask you a few details, so which helps in our management plan. Can I ask? Yes, doctor. So, can you tell me, always put an open question. Can you tell me more about your thyroid problem? So, then she will say, always open question, she will tell you. So, now first we will ask about the medical problem, then we'll move on to the pregnancy, present pregnancy. So, then you ask about the medical problem. When was it diagnosed? I can see that the medication you're taking, I can see what the medication you're taking on the which are attached here. How is the control? And so now you have to ask about because you know it is a Graves' disease, you have to ask about the symptoms of the hyperthyroidism, the particular symptoms. And I can, do you notice any eye swelling? Do you have any sweating, excessive sweating? Any shaky hands or any palpitations? And did you notice any loss of weight? And are you tolerating heat? Do you feel very hot? How about the bowel movements? Do you feel frequent stools? So these are then are you? These are the symptoms about the thyroid. Then are you visiting your thyroid doctor regularly? When did you see him last? So this is the common questions asked in every maternal case. Now coming to the medical problem is over. Present pregnancy. You ask about the present pregnancy. Now I see that you're pregnant. Is it your first pregnancy? And is it your planned pregnancy? If she says planned, I can see that you're at 9 weeks. Now, have you done your booking blood test? Because you are not seeing, they are not given in with the case scenario. Have you done your booking blood test? She will say yes or no. And if she says yes, how are they? Are they normal? Then if they are no, then you have to give her. How about the dating scan? Because she's 9 weeks, we expect her to do a dating scan, which is not given here. So you have to ask, how about the dating scan? Have you done it? Yes or no, she will say. And if she says yes, is it corresponding to your periods? Dating scan is whether it's corresponding to periods or not, to know in future whether the baby's growth is correct. Growth is correct or not. Now, are you taking folic acid? How is your pregnancy so far? And sometimes they will have bleeding or vomiting, excessive nausea, vomiting and all. So that is why. How is the pregnancy so far? Does your doctor know that you're pregnant? It is very important, especially it is uncontrolled. So, does your doctor know that you're pregnant? Doctor means her endocrinologist. Now, if it is unplanned, if she says it's unplanned pregnancy, then you say always most of the time it will be a contraception failure. Are you taking any contraceptives? Then she will say yes. Then it could be failure of that, whether missed pills or not. Then, so in that case, if it's unplanned pregnancy, you say once you deliver, we'll put you in touch with the contraception clinic for reliable contraception. Now, what are your thoughts about this pregnancy in that situation when it is unplanned pregnancy? Whether she would like to go for termination or she will continue. So that's about it. Now, coming to the gynec history, ask about his early pregnancy. Ask about the do you have regular cycles? How about your cervical screening? Then she will say whether she is done or not. So 33, she must have got invitation. Medical. Now coming to the medical history. Now, other than this, are you on any other medication other than the medication which is displayed here? And do you have any allergies? I can see that your blood group is B positive. So just say, I can see that your blood group is B positive. And any surgeries? Have you undergone any surgeries on the neck? And any family history of any thyroid problem? Any thyroid problem, sometimes it runs in the families. So any thyroid problem, any increase in the blood pressure or sugar or any clot formation in the family. Then do you smoke? Coming to social history, do you smoke or take alcohol? Pardon me for asking, any drugs? Do you take any drugs? So about that I already told in the previous station, whether if she smokes, what to do. And now I can see that your BMI is 24. Just you confirm that's all with her and don't ask BMI. So now, how is the support at home? Then just you some support is always we ask because sometimes we rule this domestic violence also. So how is the what do you do for living? Whether to know whether she is working or not, and would you like to add any? Do you feel any time down or depressed? Always in the pregnancy, it's at the booking itself they start asking this questionnaire. And would you like to add anything? So that's now coming to the general physical examination. After that, after information gathering, now we are moving on. So we have asked about the history of present illness, that is the complaints, and also of the medical condition, and also of the present pregnancy. And general physical examination, you need to know blood pressure and pulse rate. So I will ask my nurse Victoria to check your blood pressure and pulse rate. So you need not do any abdominal examination. And is it okay? Yes. Now you need to, because she has not done booking blood test, you say you need to do your booking blood test, and also we'll arrange a dating scan. So if she has not, because it's not done here, if she says no, then coming to that, so now it is over. Now coming to the applied clinical knowledge. Now we are want to discuss the problem with her. So now Victoria, let me explain to you about your blood reports. First, always explain the investigations given about your thyroid blood reports, which are given here, and also then I will explain to about the reports and about the thyroid about the care of your problem, a medical problem, and also I will give you the pregnancy care plan. I have confirmed your name, age, and NHS number. I could see that they are not normal. We need to because you are producing more of that, means you are having, it's not controlled. Your thyroid problem is not controlled. We need to adjust the dose of the thyroid medication. So then she will say, sometimes she will say, what will you do, doctor, when it's not controlled? Or when, if she doesn't ask also, you can say, now I'll speak to your thyroid doctor who will review your medication. He will give you the safe medication in the lowest possible dose. So do you have any idea about your thyroid condition? About this, that is, it is called as Graves' disease. Do you have any idea about it? No, doctor. Or she will say yes. So if she says no, then usually they say no. Then your thyroid gland here is overactive. That means it is producing excess of thyroid hormone. And because of that, you will have some symptoms like like sweating and shaky hands and eye swelling. So here the antibodies are produced against our own tissues. That is, here it is a thyroid, and there, so this condition is called an autoimmune disease, comes under as an autoimmune disease. If it is well controlled, let me tell you, Victoria, if it is well controlled, let me tell you, you can have normal pregnancy and can deliver a healthy baby. If it is not controlled, on the other hand, they can have some issues on the mom and the baby. Can I tell you what can happen if it is uncontrolled? Yes, doctor. Always take her permission. Then, then you say for mom, like if it is uncontrolled, they can be increase in the blood pressure and protein in the urine. This condition we call as preeclampsia, or sometimes they can be increase in the blood pressure. That's called hypertension, or the baby can come early. That's preterm labor. So if it is, especially if it is very poorly controlled, they can go into heart failure and also a term called, and a condition called thyroid storm. That is thyroid storm. It is a medical emergency, Victoria. It is a medical emergency where the thyroid gland becomes releases large quantities, large amount of thyroid hormone in a very short time. It is, let me tell you, it is a rare complication. But it is a medical emergency, and they may have heart failure in that case. So, then for the baby, can I tell you what happens to the baby? Yes, doctor. Then baby, there can be miscarriages. The baby can grow small, or baby can come early. Sometimes the baby during delivery, the heartbeat can stop. Baby can inherit the condition also, Victoria. And sometimes the baby can be affected by the drugs which a mom is taking, the mother is taking. Sometimes the baby skin of the scalp also can be affected. So now, Victoria, then what will you do, doctor? Because will my baby be affected? Or will I have all these problems which you told me? No, Victoria, once we will manage you, we have a team of, we will manage this thyroid problem, and also then I will tell you the pregnancy care and your thyroid doctor. It can be controlled. Your thyroid, I will send you to the thyroid doctor, or I'll talk to him and your thyroid doctor. So he will see your thyroid, he will review medical medicines, what you're taking, that is, and then he will adjust the dose. So that is what you're taking the medication called propylthiouracil and also propranolol. So he will see your medication, review them, and adjust the dose, and also they will give you the medications which are safe in pregnancy. In the lowest, let me tell you, they will give you the safe medication and lowest possible dose, because these drugs also can have some side effects. That is, they can reduce the blood cell count, white blood cells, which can cause unexplained fever, infection, some sore throat, and some rashes. And also it can affect thyroid, like liver also. So they can be yellowing of the eye, itching. In such cases, we need to stop these drugs. The doctor will stop the medicine, these drugs, and he will change to another medication. So now the other option, this is one option what we have, that is giving the medication. So he will treat you mostly with the medication. However, the other option, can I tell you the other options what we have to treat this condition? Yes, doctor. The other option is radioactive iodine. But Victoria, it is not offered in the pregnancy. Now, the third thing is about the surgery. So, surgery is usually not advised but in some conditions where there is a thyroid gland becomes bigger and it becomes enlarged, bigger, and it causes pressure on the windpipe, causing difficulty in swallowing, the windpipe causing difficulty in breathing, and pressure on the foot pipe, which causes difficulty in swallowing, and or when there is no response to the medication, or when there is an allergy to the medication, then we have to go for surgery. Or the other condition is where we suspect some cancer developing, then we have to go for surgery. But it is if at all it is surgery, we will usually do in the second and third month of pregnancy, after done in the second or third, second 3 months of the pregnancy. That is mid-pregnancy mostly. But let me tell you, Victoria, mostly it is controlled with the medication, and there's no need to go for surgery. So this is about the thyroid problem, which our thyroid doctor will manage. So now, and it will bring it under control. Now, about the pregnancy care plan, let me tell you how to take, explain to you. Your pregnancy is a high-risk pregnancy, Victoria. So your care will be under consultant-led care, and you will be taken care by a team of doctors. That is, we call them as multidisciplinary team, where your care will be managed by our consultant, the thyroid doctor, the scan doctor, and the sleep doctor, then senior midwife. So these people will be taking care of you, and you need to come. You need to come frequently. You will have frequent visits, and your medication, your thyroid doctor will see your medication, and he will reduce the dose, and then you need to continue these medications throughout your pregnancy and even after delivery also. So initially, the medicine what you're taking now, it will be continued for 12 weeks. Then later on, he changed to other medication called carbimazole. Am I clear so far? Yes, doctor. Now you have to continue folic acid. So then you need to do the booking blood test. I will arrange for that, and we also need to do other blood tests. Other blood tests like full blood count, full blood count, that is we see the hemoglobin strength and also the white cells, and thyroid test, we need to do at the booking and at every visit. And also you need to do blood test for stimulating thyroid, blood test called stimulating thyroid antibody. It is done at booking and also between 24 and 28 weeks. So am I clear? Yes. Every visit, when you come, we check your blood pressure and also urine protein to see whether blood pressure is increasing and urine protein is lost in the urine. That condition is called preeclampsia. Now, coming to the scans, Victoria, we will arrange a dating scan for you because it is not done for you. Then to see whether it's corresponding to the period date, and also then we will give a day. We'll do arrange for a down screen scan that is between 11 14 weeks to see whether baby is having any genetic problem like Down syndrome, and also then we will do a mid-pregnancy scan that is around 20 weeks to see whether any baby has any abnormalities. Now, then we will see the growth of the baby from 28 weeks. And am I clear so far? Yes. Now, at 36 weeks, anesthesia doctor will see you and he will discuss about the pain relief options. Then your consultant also will discuss the mode of delivery at 36 weeks. And let me tell you, you can have normal birth, and you can set into labor by yourself and can deliver normally. And so the baby during labor, the baby will be monitored. You will also be monitored. You will be supported throughout. And after delivery, the baby doctor is present at the time of delivery. And after the delivery, so then you will encourage the breastfeeding will be encouraged. You can continue breastfeeding, and you need to the thyroid test will be done for you after delivery to see the levels of the thyroid hormone. You need to continue thyroid medication under your advice of your thyroid doctor, because after delivery that a medical complication, medical emergency can happen, which I told you, that is thyroid flare can occur. So we will check your thyroid hormone and your thyroid doctor will take care of you. Then the medicines what you will be taking are safe in breastfeeding, but they are given sometimes, they may be given in the split doses. And blood thinners, maybe if it is required, they may give the blood thinners. So am I clear? Yes. Now, at the time of discharge, you will be given the contraception advice. So now the baby doctor, coming to the baby's care, baby doctor will check the baby's thyroid test to see whether baby is affected or not. And then so this way we will manage your pregnancy, your thyroid problem and your pregnancy. And do you have any other concern? No, doctor, everything is clear for me. So now I will document whatever we have discussed. And this is the information leaflet where with whatever we have discussed, it is there. You can read it. And then I'll connect you to the support group. And also I'll give an appointment with my consultant. And I'll give an appointment for the dating scan. And I'll give an appointment with your thyroid doctor also. So this way we will manage. Now, thank you for talking to me, Victoria. So take care.